Disseminated intravascular coagulation, also known as DIC, is a thrombohemorrhagic disorder. The term DIC comprises of three words. Disseminated means throughout the body, that is, it involves various body organs, body orifices, and wound sites as well. Intravascular is for inside the vessel, and coagulation is thrombosis. One thing I want you to remember here is that disseminated intravascular coagulation does not only comprise of coagulation. There is bleeding as well. The widespread coagulation process consumes platelets and clotting factors, leading to their deficiencies, which results into bleeding. As it consists of both thrombosis and bleeding, therefore, DIC is known as a thrombohemorrhagic disorder. Now, let's go step by step. Initially, when there is endothelial injury, it is followed by vasoconstriction. This is because vasoconstriction helps to reduce the blood loss. Also, platelets are activated. These platelets form a platelet plug, and this process is known as primary hemostasis. After that, coagulation factors are activated. These coagulation factors are normally circulating in blood but in an inactive form. Then, there is activation of fibrinogen to fibrin, which deposits on platelet plug, forming a hard plug, and this process is known as secondary hemostasis. Now, normally, when there is the process of clot formation going on, it is followed by clot degradation or fibrinolysis, and both these processes of clot formation and clot degradation occur in a complete balance. But what happens in DIC is that there is excessive clot formation as compared to clot degradation. In other words, in DIC, there is imbalance between coagulation and anticoagulation processes. As there is uncontrolled clot formation, this consumes platelets and coagulation factors. That is why DIC is also known as consumption coagulopathy. And because of deficiencies of platelets and coagulation factors, patient presents with bleeding through various sites. Recall the case of Julia. Now, can you answer why she presented with bleeding through nose and various venipuncture sites? I'm sure you can. Conditions that can lead to DIC are sepsis, commonly caused by E. coli, Neisseria, and also by other bacteria, viruses, and fungi. Obstetric complications including placental abruption, septic abortion, and retained product of conception. Certain malignancies such as carcinoma of pancreas, prostate, lung, and stomach. Acute promyelocytic leukemia as well. Major traumas such as crush injuries, burns, or extensive surgeries. In all these conditions, tissue factors are released. These tissue factors activate the coagulation cascade, leading to widespread uncontrolled coagulation. This widespread coagulation blocks the medium and small size vessels, resulting in ischemia and necrosis of different organs, and many other complications such as acute renal failure. Thrombosis of glomerular capillaries and arterioles reduces the GFR, leading to renal failure. Other complications include altered mental status, hepatic dysfunction, hemothorax, intracerebral hematoma, and venous thrombotic complications including MI and stroke. So, what laboratory investigations will you be doing? First thing first, full blood count. It will show thrombocytopenia. This is why? Because platelets are being used up in clot formation process. Blood film will show schistocytes. These are small fragmented RBCs. When RBCs pass through narrow space of clotted vessel, they break down into small fragments. Bleeding time is prolonged. This indicates the deficiencies of platelets. Prothrombin time and partial thromboplastin time will also be prolonged, indicating low level of coagulation factors. Again, why? Because they are being used up in clot formation. D-dimers will be significantly raised and there will be low level of serum fibrinogen as it is being used up in clot formation. Now there can be raised level of serum urea and creat indicating associated acute renal failure. Treatment includes supportive care, Assess the airways, breathing, and circulation of the patient. Make arrangements for transfusion in patients who are bleeding for platelets to correct platelets deficiency, fresh frozen plasma for clotting factors deficiency, cryoprecipitates for fibrinogen deficiency. Remember, don't forget to treat the underlying cause because it is what which activates the coagulation cascade. This was all for disseminated intravascular coagulation. For more such videos, watch sqadia.com.